making sure they have, I mean, you practice taking blood pressures on each other, but I don't think we ever touched like a Dynamap before. So people looking at it the first time and going like, I have no idea how to use this thing, going and take vitals. And most nurses on the floor that I've seen expect you to know how to do something, how to use that. And you have a clinical instructor with 10 people in their group, how are you gonna, you know, can't go up to each, can't be with everybody all the time. So things like that, or just making sure that they know like the little things like the tele leads and where they go. Because I think that goes a long way with gaining trust of the nurse on the floor. It's just something simple like, I know how to put on someone on tele at a minimum, or I know how to take someone's vitals with the Dynamap.
Do you think it's helpful when the instructor has worked with that specific facility too, and knows, you know, just where they keep stuff, and all the like all the equipment's sometimes different. So even equipment, and then the people on the floor. So
you want the nurse on the floor to trust you, but you also want them to trust your clinical instructor. You know, feel like you're gonna get more opportunities. And I haven't always. I felt like there's a big difference when someone's worked there and knows all the people. All the nurses on the floor trust them, know them by their first name, and have no issue with them medicating their patients or touching their lines. Even if they're a controlling person, they know it's someone, you know.
Yeah. I think to make like the experience better, just like thinking about how we started and how we ended. If you're gonna have one patient, or like, you know, follow this nurse, you know, maybe we don't even have to do anything. Like we don't really have to, you know, we don't have to give the meds, but just watching the nurse and like the nurse-to-nurse interaction, I think would have been totally beneficial.
I think there's a huge difference too in preceptorship versus being on the floors for how much I feel like I'm doing. Even when I was medicating on the floors, I did not feel like a part of the team. I did not feel like their nurse. And I know talking to other people at other schools, like someone going through med-surg clinical right now, and it's just like, especially on the days when you're not getting meds, like you have one patient, you feel like you do nothing for 8 hours. And you're learning, you go home and compile all the data that you have and you do all the sheets, but you're standing there for 8 hours wondering what to do with yourself a lot of the time. Like, so I take vitals every, you know, depending on the floor, you know, 4 hours. But if you're not medicating, you do an assessment and vitals every few hours, and some, you know, eyes and nose. It just feels very, like, you're not very useful and you're not really learning. Whereas now I'm completely immersed in being in the nurse role. Well, it feels completely different to me.
I mean, I don't know about you, but I'm introduced as, I'm your nurse, or we're your nurses.
Yeah.
Me and my preceptor are your nurses. So, and I think there's been one time where he said that I was a student, and that's because the person was like, oh, I've never met her, and he said, oh, she's my student. That makes me feel, it's, you know, it gives you that confidence, like, okay, like, this is real life, I can do this.